All right, this is Aaron Cook coming to you from Physical Therapy and Balance Center with episode 6 of our Help Yourself Learning series. It's March when we're recording this, and March is Brain Injury Awareness Month. Today we're going to be talking about post-concussion syndrome and why a physical therapist might be the best provider for you to see after you've had a concussion. So if you follow the NFL like I do, I'm a big Browns fan. We just got Amari Cooper yesterday. I'm really excited about it. If you follow the NFL, you know that we've spent a lot of time the last decade or so being much more aware of concussion. I think the public knowledge and understanding of concussion has improved a tremendous amount over the last few years. A lot of people are able to tell if they've had a concussion. You know, it was a very traumatic event, maybe a car accident. There's a number of different symptoms that you would have experienced after a concussion. Most commonly like a headache, double vision, maybe some cognitive changes or memory loss, headaches, ringing in the ears, dizziness. There's a lot of different things that go in with a concussion. A lot of people are aware that they may have had a concussion. What is less common and what people are less aware of is post-concussion syndrome. That's what we're going to be talking about today. So the good news is for most concussions, about 90%, 85%, depending on who you ask, the concussion is going to heal just fine on its own. People are going to make a full recovery. They're not going to need a lot of interventions. They just kind of need coached through it the right way. So that's the optimistic side. But we're here to talk about the 15% that doesn't happen, and they develop this post-concussion syndrome. So the key question is, what is post-concussion syndrome? And it's symptoms of a concussion that last for an extended period of time. I believe the diagnostic criteria is at least 3 months, but this can last for months, if not years, if not treated properly. So why a physical therapist is so beneficial is because these concussions are so intricate, there's all these different symptoms, and it's unrelated to the person. It may be a headache, and then it's nausea, and then it's eye strain, and then they're depressed, and then they're losing their balance. It's a lot of different things going together. And because we spend so much time with our patients, we're really able to pick up on some of these little subtle things. So when it comes to post-concussion syndrome, they talk about 5 different subtypes. So you have your anxiety and mood disorders, you have your cognitive fatigue, you have your headaches / migraines. Those go hand in hand, but are not necessarily the same thing. You have ocular motor deficits and vestibular deficits are the 5 main subtypes. They also talk about sleep disturbances and cervical strains as a concussion exacerbating or aggravating event. In therapy, we always talk about how the amount of force, like the actual G-force to cause a concussion, is greater than the amount of G-force that's needed to cause a neck strain. So technically speaking, it's impossible to get a concussion and not have a cervical strain. So we have all these different subtypes, and just to make things more confusing, you can get more than one subtype at the same time. So you can have people that have mood disturbances that also have a neck injury and also have some ocular motor deficits where they have some issues with the way their eyes move, and that causes them things like nausea or blurred vision. So I just want to do a quick run through of how PT can help a lot of these different subtypes. So headache and neck strain, that is bread and butter for PT. That is, most PTs would be able to get you some good treatment for those 2 conditions. A lot of times they go hand in hand. They talk about cervicogenic headaches, meaning the neck pain is causing a headache. But a lot of times with the trauma from a concussion, particularly if it involves the jaw, sometimes there can be TMJ or jaw issues that can trigger a headache. And most PTs are very well trained on how to screen these out, identify if it's a problem, do some stretching, some manual therapy just to kind of relax whatever's causing those headaches. And we're really good about figuring out, okay, this muscle's aggravating, this is this type of headache. For the ocular motor deficits, that's something PTs can walk you through specific eye exercises or different training tasks that you can do to feel more comfortable with your eye movement so you're not feeling that eye strain or that eye fatigue. When it comes to the vestibular subtype, that's something that physical, that's our bread and butter. That's people with dizziness, that's people with, they turn their head too quick and they just get off balance, or they were a 20-year-old, they had a concussion, and now they struggle from time to time just getting up in the morning. Maybe they're a little unsteady, a little uneasy, and it's not uncommon for very high-level athletes to have issues with their balance. Otherwise healthy, otherwise active and in shape, strong as an ox, but because it's their vestibular system, meaning their inner ear, they can't always walk properly. Sometimes that needs some nuanced balance training. As far as the other subtypes, the anxiety, the mood, some of the sleep issues, or the cognitive fatigue, that's not something PT is going to directly help with. We certainly can make suggestions. It's nice to tell somebody who has sleep dysregulation, hey, you should try going to bed at the same time every day. Maybe the reason your concussion's not healing is because one day you're staying up till 3 a.m. and the next day you're falling asleep at 8 p.m. and one day you're taking a 4-hour nap. We're not sleep experts, but we can make some general recommendations or some general advice on the things you really want to avoid. But obviously, for those more nuanced, because we spend so much time with our patients, we're going to recognize that these are problems. Say, hey, go see a psychiatrist, go see your neurologist, go get a sleep study, see what you can do, go seek out that specialty care to really maximize your recovery. And then, the big rage now is multidisciplinary care. That's really, and concussion is probably, of all diagnoses, that's probably the most multidisciplinary diagnosis dated. Concussion and post-concussion requires such a multidisciplinary approach, meaning it really does take a team. There's a lot of conditions, we get a little cocky as therapists. We think we can solve everything ourselves. But concussion is something where you really need a good team around you. You need to have a good neurologist or a psychiatrist or a psychologist or a speech and language pathologist if there's cognitive issues or if there's learning issues. You really need to have a good team. And at Physical, that's something we're really hoping to provide to the Lake County communities. We're hoping to really get out there, really be those trusted experts for concussions so we can help handle people or help people improve the most. All right, so if you are watching this video, you're probably thinking, maybe some of this applies to you. Give us a call. We'll take a look at you, do a thorough exam, see how we can help you. It's always nice just to get a second pair of eyes and ears on a problem. Particularly with post-concussion syndrome, I always call it the Goldilocks syndrome. Most people who've had a concussion, they're either doing too much or too little. And it's all about finding that sweet spot right in the middle, so you can promote brain health and brain healing, but not overdo it and causing a flare-up of symptoms. So hopefully that was helpful. See you next time.